My name is Martin Kiyeng from Last Mile Medicine, in which we are collecting the fragmented pharmaceutical supply chain through matchmaking platform of surplus, unused, unopened, and expired medicine to those who need it the most. Through this, we are restoring health and reducing. Looking at the Kenya health finance situation analysis, 1.5 million Kenyans are pushed below the national poverty threshold annually as a result of paying for healthcare service. Three in four Kenyans are at the risk of falling below the poverty line because of direct out-of-pocket payments. All this is with COVID-19. This is expected to be devastating because of health and economic shock. Meet James Akoth, 52 years, father of 4 children, 3 in primary school and 1 in Form 1. He was diagnosed with cancer of the breast in 2018. Initially, didn't have NHIF cover. He has 20 chemo sessions to be covered by NHIF. He spends close to 15,000 per month on medicine for the next 12 years. He will spend $21,600 in 12 years. No, we have to know that there are other competing needs, like the need to eat balanced diet, and the other things. The children needs to go to school. When all this is happening, the Kenya Harmonized Healthcare Facility Assessment Report indicates that only 46% of healthcare facilities, both public and private, have no records and process in place to ensure disposal of expired or unusable drugs. And we just recently, last year, drugs worth 1.2 billion from KEPSA, which were yet to expire in the next 7 years, had not been dispensed. 1 in 4 deaths among adult women are caused by non-communicable disease such as cancer, diabetes, and we know all these people live by drug, and drug is what they survive. How we work, we are repurposing unused drugs in drug supply chain from manufacturer to the pharmacies, in which the patient comes to the pharmacies with prescription. The pharmacies verify if it's from a licensed practitioner, and after receiving the pharmacist then looks at what drugs is available in the platform as a surplus, and then they connect them. This is where our work ends from. So in all this, we look at ourselves as an inventory management and expert matching in repurposing surplus our unused drugs. Our customer segments is the underinsured and uninsured low-income patient, which as per now 16% are covered by NHIF nationally and 1% by private insurance. Just recently in Nyeri, 700,000 residents were forced to pay, were forced out of NHIF because the government is no longer paying for their medical health insurance. Others is the pharmaceuticals. The other one is NGO and organization, researchers, wholesalers, and looking at the channel that stems from from the producers to the manufacturers to the distributors to the wholesalers to the healthcare facilities to the pharmacies and the patient. We come in as the intersection. Just to emphasize, we are not a consumer-faced company. Like the existing partners like MyDawa, we work so closely with the pharmacies. Our point of reference is the pharmacy. What we charge is from B2C, we charge a percentage from the drugs that are bought, which is 70% lower than the market price. On B2B2C, where partner fully incentivized or partially, we charge a fee to utilize our platform. Through the pharmacist gets a percentage of connection of patient to the available surplus drugs. Or in all this, we are adhering to the patient care principle of access to medicine, adherence to medication, and affordability, in which in all these, drugs that were rendered to be thrown away are utilized. Our key partners from regulators, the Pharmacy and Poisons Board, the Pharmaceutical Society of Kenya, the pharmaceuticals, manufacturers, wholesalers, and suppliers. In all this, we see we reach out to them. Under Ministry of Health, we've reached out to Makadara and Mukuru sub-county. Our impact is improved in healthcare outcomes. As we know, currently people are not going to the healthcare facility. So they are utilizing the mom and pop pharmacies. So with this, we aim at increasing awareness for the public sector and drug adherence by 40% and optimizing sales force strategy and promotional effort. Our timeline is is focusing on two things: customer service and the platform. We aim at refining our platform, pivoting, and the amp scale. This is made able by able team of James Mwangi, who has MPH and more than 7 years in health with MNE, and I myself, Martin Kiyeng, with more than 7 years in health and social programs. There's Martin Agaya, there's the Bukaya Doboso, and Lois Duku. Thank you. Let's enable everyone have the right to life-saving medicine. Thank you.